Good evening to everyone here. Thank you for joining us here today. Just a little bit introduction about myself. I'm Dr. Wong Pei Si. I'm a pharmacist by profession, currently an associate professor in the School of Pharmacy at IMU. Okay, and I'm also the Associate Dean of Teaching Learning. I'm really happy that all of you are here today joining us in this webinar. I'll be the moderator for the session. So this session title is Pharmacy the Right Program for you, obviously for me or for you, okay? And joining me here today, as you can see on the video, we have my colleague, Dr. Dinesh Kumar, who's the Program Director of Pharmacy at IMU, and of course, one of our alumni, Laura, okay? Before we start the session, I just want to highlight a few housekeeping rules. So we have muted all your microphone. So if you can see at the bottom, there's a Q&A panel. So along as you are listening to their sharing, if you have any questions, anything that you'd like to find out and ask, please put your questions and feedback into this Q&A panel. All right. The whole session at the moment is recorded. And as I said, the Q&A side, we will actually answer and discuss all the questions as much as we can at the end of the True Talk. Okay, so you are here today because our webinar session is really talking about decision making in what to study and where to study. And I know decision making on what to study, where to study can be sometimes difficult. Perhaps many of you here present today are because you're interested in pharmacy course. Okay, and in this session, as I've mentioned, we hope we'll be able to share a little bit more with you if pharmacy program is the right course for you or not. And together with me, I have my colleague and also Laura, who's alumni. Okay, and they will be, both of them will be sharing part of what they think about the program and their experience with it. Okay, and as I said, we will answer all the Q&A questions at the end of their talk. Okay. I'm going to just introduce our first speaker, basically Associate Professor Dr. Dinesh Kumar. Okay, Dr. Dinesh is basically the Associate Professor in the Department of Life Sciences at School of Pharmacy, and he's currently the person in charge of the pharmacy program. So he's the Program Director of Pharmacy course at IMU. And he himself is a pharmacist with over 15 years of working experience in academic and a very, very established researchers as well. And if you are following our Facebook of School of Pharmacy Facebook, you will actually see him appearing in a lot of news, sometimes on posting relevant to research studies, because he had a lot of projects relevant to diabetes, natural product, and cardiovascular disease. Okay, Dr. Dinesh, are you ready to share your talk? Yeah.
Yes.
Yeah.
Okay, so a very good evening to all of you. So it's nice to see all of you here for this specific talk. All right, so what I'm specifically going to do this evening is that I'm going to share something about this program called Pharmacy. Okay, so I think by the end of this session, you will come to know whether pharmacy is the right program for you or not. Okay, so myself, I am actually Dinesh. Actually, I'm actually the program director currently at the IMU for the Bachelor of Pharmacy program. So without wasting much time, let me just go into the slides. Okay, so when we say pharmacist, okay, so what comes to our mind when you think of a pharmacist? Okay, so pharmacists are basically, probably you might have seen, because sometimes when you go out to get some medications or for medications for someone else, so we obviously need to go to pharmacy. So when we go to a pharmacy, you see someone there called as pharmacist, right? So they are the one I'm talking about, pharmacists. So pharmacists are basically, they are medication experts. They prepare and they dispense, prescriptions. So, and they ensure that medicines and doses are correct, prevent harmful, adverse reactions or drug interactions. And they counsel the patients, okay, on how to take the medicine, also on the safety of how to use or consume the medicine safely. Okay, so that's in a nutshell what a pharmacist does. Okay, now coming on to this program in IMU. So our Bachelor of Pharmacy program, it was launched in the year 2004. Okay, so our BPharm program is an honors program. It has 4 years with 8 semesters in it. And we have 2 intakes, which are July and September intake. And our BPharm program is accredited by MQA and the Pharmacy Board Malaysia, which are the accrediting bodies in Malaysia. Okay, the most important highlight about our program is that we have 2 partner schools, which are University of Otago in New Zealand and University of Tasmania in Australia. So students get a chance. Why I'm highlighting this in the beginning is because this is something, it's useful for you to know at the beginning. Okay, so these 2 universities provide credit transfer options, meaning that students who get enrolled in our program, they study 2 years in IMU, and after that, the remaining 2 years, they can choose if they want to go to any of these partner schools. So this option is called as a credit transfer option. All right. So students will get the certificate or the degree eventually from this respective universities, if at all they prefer to go here. So this is one of the highlights of our program. And moving on, we also have some other highlights which I've listed down here. Maybe I need to read it to you also. Our teaching and learning is up to date. Okay. And recently we have also included digital health content. So because the world is changing, we need to keep in pace with the changing world. So we have included digital health. We have included concepts like artificial intelligence. We have concepts like big data. All these are now incorporated, meaning that our program actually is in line with the latest revolution and developments happening around us. Our latest curriculum was revised last year, which is 2022. So the first batch of students actually with this new curriculum, they actually entered in September 2022. So you know that we are keeping in pace with the changing world so that when students go out after doing our pharmacy degree, they are not caught behind, they are actually in pace with the developing world. So we also provide students early exposure to placement sites starting from semester. We call this as experiential learning. So students get to know, or students get exposure to placement sites, okay, so that they know they're not caught up only in the end of the program, but they get used to these placements from the early part of the program. So they have enhanced placement opportunities as well. For example, students, especially when they are in the semester 7, they are expected to do some research. So we also provide them support for the students, for them to get an exposure, for example, in overseas universities. For example, I can tell you, University of Sydney, Australia. So, some of our students have gone there. So why am I telling this? Because these students, when they go there, they get the best of 2 worlds. So they get an exposure there, and they get to know how these advanced equipments are used over there as well. Then the students also get a longitudinal experiential learning opportunities. Okay, the experiential learning is longitudinal, it's stuck in one semester, it's actually across the semesters. Okay, then they gain global experience. So you will know actually as I go through, we have something called as elective modules where students get to choose something which they want to do. We call that as elective. So even for elective, and as like what I told you, the research, we give them, or we create a chance for the students to get a global experience. So we have partner schools. Not only that, we also have MOUs and MOAs with several international universities. Apart from that, we also have these mandatory placements in all sectors, for example, community, hospital, and pharmaceutical industries. Again, we need this because students need to get the first-hand knowledge about what happens in all these setups, maybe community, hospital, or research industries. So as a pharmacist, students need to get this exposure in all these 3 setups. So that's why we have all these components in our BPharm program. And involvement of industrial experts, we invite people from all these 3 different setups to come and speak to our students, meaning that they come here and they deliver lectures, they conduct workshops sometimes. So we actually involve experts, the real experts. So students get a first-hand knowledge about what exactly is going on in their respective setups. And we also involve pharmacy alumni as mentors. Now today also, we are going to see one of our alumni who is going to speak with you. So you get an idea about what as an alumni, they share with you as well. So these are some of the highlights of the BPharm program. Okay. And if you look into this slide, I'm showing you the program structure. So as I mentioned to you, we have 8 semesters. So starting from semester 1 to semester 8. So our curriculum is designed in such a way that, initial part of the program will be more of faculty-led, meaning that we guide the students very well, because when students come from schools, they're kind of sometimes lost. So we guide them very well starting from semester 1. But this doesn't happen throughout the program. As the student progresses from, say, semester 1 to 2 and 3 and on, then it becomes we actually indirectly provide them kind of scenario or opportunities for them to develop themselves. So it wouldn't be full faculty-led. So as they progress, it will slowly turn on to student-led. And by the time the student reaches semester 5 and 6 and all, it will be more predominantly student-led, meaning that they will be doing a lot of things on their own. It could be learning, it could be activities, but for all these, there will be supervisors, there will be lecturers who are guiding them. So that's how we have designed our curriculum. And this is the program structure, what you see here. So some of the things which I think I can highlight to you here is that when the students come to semester 7, they have this research project. As I told you, they have research project, industrial placement, and elective. All these are kind of activities for the students to do, and they will be exposed. They'll be exposed to different setups, research, industry, and in electives, they get a chance to go to whichever setups they would prefer to, and it's purely the choice of the students. So students get much of to implement their own interest in a way. Okay, so, and not only that, if you see the workload, say for example, as a student, when the student joins in this program, the student is actually, the whole thing actually, what you see here is well balanced. Okay, meaning that let it be lectures, or let it be hands-on practical sessions, or let it be workshops, or something like we call as PBLs, problem-based learning sessions. I think everything is in a way balanced, so that students can really fit well and accommodate. And one very important thing which I would like to highlight at this place is that every individual student will be assigned to a staff mentor. So every student will have a chance to actually get support from a mentor. The mentor is actually a staff member. It can be a lecturer or from the same department, but it can be from the same school. So anything the student faces, from any part of this semester, they always get the chance to speak to the mentors to sort out the issues. Maybe they can't understand a certain topic, or maybe they want to speak to another lecturer about a certain topic. The mentors will be there always to help them to to sort out all the issues. And the last thing about in terms of support, what the school provides is that IMU has a very well established self-development unit. Say, for example, what they do is that they actually care for the students. In case if a student is feeling down, or in case if the student is feeling disturbed, or it's very stressed out, or if the student is going into depression or anything for that reason, So the self-development unit in IMU, they take care of the students. They take care very well, because IMU has established panel of doctors. So they take care of the student very well. And we have many examples where when the students join, they found it very hard to cope up. But with the help of the self-development unit, they come out of those, and also along with the help of the mentor. So over a period of time, students they come out of that shell, and they become the real individual who they're meant to be. So our program is designed in such a way that, it actually helps the student to become the individual what they're supposed to be, which is a real pharmacist. So I wouldn't want to take much time. So these are our teaching methods. So we have different types of teaching methods. We have lectures, we have tutorials, workshops, problem-based learning. If you see carefully, all these have their own advantages. So in terms of problem-based learning, students get to speak. Even if the student is kind of a shy student, we see that over a period of 4 years, when the program is over, the student becomes very, very capable to talk even in public. So in the beginning, even though they might be shy students, but when they reach the final part of the program, they are comfortable already. So electives, visits, research, community placements, internships, it's a full package. So you name it, all the criteria, the competencies are covered in the teaching methods. Name it, it can be communication skills, it can be empathy, it can be learning, it can be writing skills. Almost all these competencies are covered within this our BPharm curriculum. So these are our hospital partners. If you have seen the previous slides, there's students are actually placed in hospitals at two points in the entire curriculum. These are major ones, but apart from that, there are also minor placements. But the major placements, they actually get to choose from this among these hospitals. So we have a well-established team who work on this, and they find placements for the students, and they help the students. So student doesn't need to kind of go through all the hassle and all those things. So these are our hospital partners. We also have community pharmacy partners. So meaning that if a student joins our pharmacy program, they get placed in any of these community partners or the hospital partners for placements. So where they learn, where they train, and where they learn. So these are the placement partners, and these are our industry partners. Like what I told you, our program is very unique in a way that it covers all the 3 different segments: hospital, community section, and also industry section. So students get to know everything in all these 3 different, because once they finish the pharmacy program, they can get a job in any of these, either in a hospital or in a community setup or even in industry. So our curriculum is set in such a way that they wouldn't be left out. They will get something from any of these 3. And these are our research collaborators. We have research collaborators from all these universities, what you see here. So we have staff members who actually work closely with these universities, and our collaborators are spread out across the globe. So if a student wants to take up a research project in any of such university, we help the student because now this year onwards, there's one more good news, is that we have set up something called as a student mobility fund, which is called as a global funding. It's a global fund. So it becomes even more easier if, say, example, if a student wants to go to get an exposure. So if, say, for example, if I join the pharmacy program in IMU, so when I reach semester 7, I can choose which of these partners I would like to go and do my research. So provided there is a project there. So it's good in a way that the students get a feel of, the students get to know the best of 2 worlds. So these are our research partners. We also have elective opportunities where, like I told you, electives are purely chosen by the students. Now, these are some of the examples, our past examples, where students have gone over to these setups and they have gained some knowledge in these electives. For example, the first picture, what you see is that this particular student actually went all the way to India to gain some kind of exposure on how pharmacy students work there in the labs in an Indian university. So that student went over to India. So all these are different. The last one, if you see, is actually an elective in a hospital in Taiwan. It's a very popular option. Many students usually tend to prefer this option, especially, and generally the elective duration is 2 months. Okay, so in these 2 months, students make the most of it. That means they try to utilize all these 2 months for their own benefit, because anyway, all this adds up into their resume and strengthens their resume. We usually have a survey. This is not made up. This is the real facts, what we are producing here. And then the name of the survey is called as iBarometer. So iBarometer is a very popular survey, not only in IMU, but it has been conducted across most of the universities. So these are the findings from that survey. So what our students like about the BPharm program. So what is listed down here, all those feedback which were provided by the students, the opportunity to provide feedback, facilities and study environment, focus of clinical learning, quality teaching materials, reputation of the university. So all these are points which are highlighted by the students about our B.Pharm program. And coming to the career opportunities, there are plenty of career opportunities. Okay, so students can get placed in community setup, hospital, or industry setup. So you can see I have listed down several of the divisions where in each of these setup they can work. Say, for example, if a student decides to go to hospital, a student can work in clinical pharmacy or therapeutic drug monitoring, parental nutrition. So there are plenty of options for a student to choose from, especially when it comes to career. So not only that, even in the governments or government bodies, they can work as a drug inspector or as a regulatory affair officer. There are many options. Even in the armed forces, we have some of our students who are currently working in the Malaysian Armed Forces. We call them as military pharmacists, and academia as well. So we also provide the students an opportunity to progress further, because we also have a master's program. So some of the students, we have seen that once they have completed their B.Pharm, they come into the master program and they grow in that route. So they get themselves into academia, and then because some of the students, they are very keen to become teachers. So they get into the academic stream, and also some of them get into entrepreneurship. So we have several career opportunities, especially for the pharmacists. So with that, I conclude my talk. So thank you so much for your patient listening.
Thank you very much, Dinesh. Okay, for those of you who would have maybe after listening to this talk, you have some question in mind about pharmacy program and all that, please remember to just put into the Q&A box now. So we will now go to our second speaker first before we go through some of the questions that some of you have posted. All right. Our second speaker is actually Laura. All right, Laura is our alumni. I think proudly to introduce, she's one of our graduates. She joined the IMU Bachelor of Pharmacy program in 2015, and then she graduated in 2019. And she's now actually proudly working as a registered pharmacist in Hospital Queen Elizabeth II in Kota Kinabalu. Yeah, I think it's really great for her to spend her time today here to share with all of you, of a little bit of experience of how she had been going through when she was in IMU. And again, of course, please feel free if you have any questions in mind, please put into the Q&A box if you have. All right. Okay. Laura, are you ready? Perhaps you can start sharing your slide.
Okay. Thank you for the introduction, and thank you for the opportunity to walk down the memory lane here. I graduated from IMU in 2019, so it's been quite some time already. So hello everyone, I am Laura and I come from Kota Kinabalu, Sabah. Any Sabahans here? So as a Sabahan, it was difficult for me after completing my A-levels because the options for tertiary education here was quite limited. In the end, I decided to pursue pharmacy at IMU because it is a prestigious university that specializes wholly in medical and health sciences education. So it felt pretty daunting and scary at first because I had to leave my family for the first time, and I have to learn how to live alone and juggle my studies at the same time. But I think I adjusted quite okay because IMU provides a very conducive and safe environment to study. I also managed to rent a nice place right opposite to IMU, so everything was quite convenient and comfortable. So at the start of my Bachelor of Pharmacy program, it was mainly to build our skills and knowledge. So there were lots of lectures, tutorials, and something we called problem-based learning sessions. So from what we see from the top photo here, it's where we sit in a smaller group with one lecturer and we would learn a topic together. So other than that, we would have lab works. So we would go to laboratory to learn things like physiology, chemical properties, and drug formulations. And of course, the pharmacy skills development over here, where we learn things like different types of medical devices. We have different types of inhalers, insulin pens, and most importantly, that's where we learn how to communicate with doctors as well as communicate with patients. So the later stage of the B.Pharm program is like being exposed to the real world, and that was when we can apply what we have learned. So for example, we had our hospital attachment. So that's where we go to different departments, and that's where we see how medications are supplied to the ward patients, to clinic patients at the outpatient settings. And we also got to go to hospital wards to learn different cases by patient basis. And other than that, we also had our attachments at retail pharmacies and pharmaceutical industries. And out of our schoolwork, we have community projects. For example, we did like health talks and diabetes talks in elderly homes. I think the best part of this is that even though I took the local bee farm program, I got to have overseas experience, not just once, but twice. So the first one was during my third year, where we had our elective module, and I chose to do a community pharmacy placement in Western Australia. So I got to learn about their healthcare system and practice, and what's the work like as a pharmacist in Australia. So it was a very lovely learning experience. And in fact, I wasn't the only one who got to have this overseas experience. Some of my batchmates went to places like Taiwan, Japan, other places of Australia, and so on. So for the second overseas experience, it was for my final year research project. Our research project was about formulating a Chinese herb and make it into tiny, tiny nanoparticles. And then we would test the antibacterial effects on wound bacteria. So as you can see from the photo, Dr. Dinesh was one of my supervisors back then. The first half of it was done in IMU. So my supervisors had been very supportive, and they were experts in their own field. So they could actually help us with our research work, especially with making those nanoparticles successfully. So once that was done, our formulation was sent across the ocean to Queensland, Australia. So this is where we carried out the second half of our research. And this is Institute of Health and Biomedical Innovation based in Queensland University of Technology in Kelvin Grove. So we had the opportunity to observe other PhD students to demonstrate their lab works, and they were relevant to our research work because this team, they are expert in studying herbal plants and their anti-cancer properties, antibacterial effects, and so on. So after that, we carried out our research in the lab at QUT, and in the right photo, you can see my research partner making more of the herbal nanoparticles. And in the left photo, you can see me assessing on the antibacterial effects. So what we did was we spread the bacteria. So this is our supervisor at QUT, Dr. Trudy, and her team at QUT. They were very supportive and were there throughout our research. And I was glad when Dr. Trudy is happy when our formulation showed some effects on the gram-negative bacteria, because they were actually harder to kill due to the outer shell. If you are a science student, you would understand that. So even until now, I still kept in touch with some of our friends here that we met in QUT. They have graduated from their PhD programs already, so they would offer me some advice on doing a postgraduate program. So of course, the bonus of going overseas is that you can explore the beauty of another place when the work is done. So fast forward, after graduating from IMU, I flew to Yogyakarta to present my research in the Asian Young Pharmacists Group Leadership Summit. This was my first time presenting in a scientific conference, and I was so happy to be announced as the winner for Best Poster Presentation. And I would like to thank IMU, QUT, and our other collaborators for making this possible. So right now, I'm currently working as a pharmacist at a government hospital in Sabah, and I'm taking on more clinical-based work right now, like the diabetes medication adherence program, where I get to follow up with diabetes patients to help them gain control of their blood sugar. So it was very satisfying, especially when patients first came in with their blood sugar all haywire, all in a bad shape. And then after following up with them, their blood sugar are much more controlled and at a much safer level. So other than my usual pharmacy work at the hospital, I would do research work. So I get to enjoy the best of both worlds. As far as I know, not many people are interested in doing research in my field, but because I had this wonderful research experience back in IMU, So it became like a burning fuel for me to continue doing research, and it has actually become one of my hobbies now. So I continued to present in conferences, win awards, and publish more papers. And the best part is when the research that we do can actually make a positive difference in our healthcare practice and ultimately for the benefits of our patients. So I shall end my talk here. So thank you, and I wish you all the best, because if I can do it, you can do it too.
Thank you, Laura. Yeah. I think it's great to see, how Laura has been, moving from her journey basically throughout in IMU. All right. Yeah. We have actually a few questions, and some are probably relating to the job, scope as well. Perhaps going through the first questions that we have here is, perhaps Laura, you could share with us. I think one of the person, would like to know how do you finally get yourself registered? Would you be able to share, how have you, the process that you have taken to get yourself registered as a pharmacist? Yeah.
Oh, once we graduate, we would register under the system, and then we would go through something what we call as a PRP, or in layman term, we call it as a pharmacist housemanship. Usually this training will take like 1 year time. And once that's done, you complete your logbook and all assessments, that you pass all your assessments for your logbook, then you're set to apply for full registration.
How would you describe your sort of the 1 year of housemanship that you had? Was it a hectic schedule? How does it work?
Very productive. We get to go, yeah. We get to go to different departments in that 1 year. So you get to go to outpatient, inpatient, go to clinical settings where we go to the ward and learn by case basis. And then other departments like going to store to see how the stock level is managed, to learn basic things like that. And then going to pre-packing and all that. Yeah, so all done in 1 year.
Yeah. So just to sort of add on to what Laura was describing, is that Laura did her what we call PRP, which is a provisional registered pharmacist training 1 year basically in hospital, because she, then later on, of course, she become the pharmacist in hospital. But of course, at the moment, Malaysia also, Pharmacy Board also allowed the training to be done under a few other areas. Number 2 is you can work in a community pharmacy as well. You can also work in the pharmaceutical companies, all right? And finally, you can also work with universities that are registered as a site for housemanship. An example, IMU is one of the sites. So yes, IMU is also one of the site for housemanship. So which means that students who are interested upon graduation to work in the area of research and development, all right, IMU does offer a choice for them to actually consider that. Yeah. So for more detail, basically students who are working or basically doing housemanship with IMU post-graduation, they will need to be working in the research area. So normally the students will be embarking on a master program at the same time. Yeah, Dinesh, would you like to add on anything about that?
Yes, that's right. So just like how Dr. Wong said just now, so students can actually choose whether to go into the academic field. So it can be an academic stream, or it can be by research. So in IME, what we do is that we ask a student to do this master's by research, if it is research stream, or other one is a master of pharmacy practice, if it's academic stream, that's a taught stream. So students get to choose because of this is possible because of the government initiatives. They call it as liberalization. So previously we didn't have this chance or opportunity, but now students have this opportunity to do even in registered or recognized institutions as well. Yeah.
Yeah, Laura, how soon did you manage to get your PRP? Manage to get a job as a PRP in the Ministry of Health?
I think because now everything was done online, so I got it pretty fast, like 2-3 months.
2,
couple
3
of
months.
Yeah.
All right. Okay. I think that there is a question that is asked whether there is data with pharmacy graduate employment rate. As I know, I don't think there are such really reporting. Okay. But from our experience, basically students or graduate normally would be able to get a PRP position within 3 to 6 months. As long as you apply, because it actually subjected to whether the student themselves or the graduate themselves applied or not.
Yes.
But if they apply, normally they would be able to find a PRP position within a 3 to 6 months. Laura, do you think that's a fair range of time that I'm actually telling? Yeah. Yeah. So because I mean, from my side, I haven't heard any students who had actually difficulty in trying one. As I say, as long as you are willing to apply, whether you decided to go into Ministry of Health, community pharmacy, or you would like to work on R&D, as long as you find and try to approach some companies, normally they would be able to find a job, a PRP position pretty fast. Yeah. So that depends on how fast they actually go into it. Yeah. So Laura, do you think is it very tough? How do you feel about these 4 years? Is it a very tough thing to do? A tough course to do?
I think from my experience, studying pharmacy is still manageable. Yeah. Of course, there will be stressful times like during exam period or pharmacy skills assessments. But I think my family and friends in IMU are quite supportive, and the lecturers in IMU are also quite supportive as well. So they were always there for us when we are lost in our studies and schoolwork and so on. Yeah.
Yeah. So Dinesh, how about you? How I mean, from your experience, how do you see this course? Was it a very tough course?
We do have students when they join the program, they say it's quite tough. But once they get a hand on the program, then it's quite comfortable for them, because initially, say for example, semester 1, we have students, even some of my mentees, they come and tell, is because it's the shift what gives them that stress from when they shift from the schooling to the university, there is a slight shift, but that's only for the initial period of say few weeks, or when they get mingled with their friends, and then they get the hang of it, then they're okay. And then they know what to do. Then they know how to proceed. They get used to, because students these days are very smart. They're very smart. They adapt really quick.
Yeah.
So yeah.
I fully agree to it, right? Yeah. Students, I mean, for somehow adapt quite fast nowadays, and they are, I mean, obviously every students learn different ways, but I would have to say the great thing is that we offer many different approaches in our way of teaching learning. So we have online, we have, books, we have guided reading, we have lectures, we have workshops. So there are plenty of ways of how, a lesson are being delivered to students. So different students with different learning style probably would be using different ways of how they wanted to study. And what Dr. Dinesh has explained just now is that normally the more difficult part is the first year, perhaps, the transition period, when you're moving from a pre-university courses, example, whether you're in A-level, STPM, when you're trying to move into university life, with a new environment and all that, where that probably will be the first the first 6 months, you might find it a little bit more difficult. But if the students, slowly cope well, with some friends and all that, then normally they will do better as they go. And we also have a very strong team of teachers, and all students have mentors to support them as well. So I think that's what's available in IMU at the moment to support basically students. Basically, there are also questions asking, what are the most important subjects in pharmacy? Yeah. Or what do you think, Dinesh? Yeah.
I think there are 4 most important subjects, starting with, you can say, chemistry. Chemistry is covered in few of the semesters. The second important subject will be pharmacology. But I missed one. Actually, pharmacy practice is the second most important. Then comes pharmacology. I'm talking from the amount of content in this specific subject. So it will be chemistry, pharmacy practice, pharmacology, and then finally pharm tech. Pharm tech is nothing but where the students learn about how to manufacture medicines in a company setup or industry setup. So these four are the major areas, or in terms of student learning. But apart from that, there are other supporting areas. For example, now digital content we have a module from business administration. We have a module from ethics and law. So these are supporting modules, but the core areas will be the four which I mentioned.
Yeah. Yes, I agree. I think generally, normally pharmacy will need to study a lot about the the chemical structures of the drugs and all that. So, but when you have the 4 years, you will see that each years you'll be studying basics down to more and more clinical as it goes. So which means that in a pharmacy program, as what Dr. Dinesh has actually shown you, you will realize that the first 2 years normally are very concentrated on the basic sciences. Yeah, so as the student progresses, you will see more and more about patients, more about people, and of course, Laura also tell you, share with you, we do a lot of training on communication skills as well, so because that's part of what pharmacists will need to do. Yeah. All right. Just to share, just to answer back to some of the questions relevant to years of course, basically IMU, we are offering a 4 years pharmacy degree. Of course, for those who have completed the 4 years degree, if they wish to, they can always continue to do a postgraduate studies. Yeah. Perhaps Dr. Dinesh can share a little bit, what are the opportunities for furthering studies from pharmacy?
So once a student completes the BPharm program, students there are many avenues where they can venture into. One of them is actually doing post-graduation. So post-graduation meaning that they can further and they get a master's degree. So in IMU, we do have some postgraduate degrees. For example, we have Master of Molecular Medicine, that's one. And we do have some students from pharmacy who comes into the Master of Molecular Medicine program. We also have Master of Pharmacy Practice, which is actually run by the Pharmacy Practice Department. And we also have one postgraduate program run by the Pharmaceutical Chemistry Department, which is Analytical Chemistry. So these are some of the postgraduate programs in IMU, but there are other postgraduate programs. For example, one of the highlights when it comes to postgraduate programs, what we have in IMU is that we have a collaboration with Queen Mary University in London, especially students who join this IMU Master of Molecular Medicine, they have a chance to get a dual degree. So they do the Masters of Molecular Medicine, and then they do a certain content which is from the Queen Mary, and then they get a dual degree. So it's advantages for the students. So whichever direction they go, they are advantageous. No, this is only within IMU, but if you go outside IMU also, there are plenty of postgraduate programs to choose from. And some of our students usually go overseas to do their postgraduate because students feel that sometimes overseas there are plenty of scholarships available, especially for some countries like Australia and some of the universities in the UK. They have plenty of opportunities, especially in terms of scholarships. So they also further in that direction as well. So there are, in terms of options, the students have plenty of options to further their studies.
Yeah, just to add on is that I think most of the people or most of the students will consider all this postgraduate when they are near to completion of the course itself, because during the course itself, you'll be exposing yourself to many different subjects, topics and all that. And of course, with the development of education, especially advances in postgraduate studies, you'll be surprised that there are many ranges of courses that is coming out nowadays. So I also have, some graduates that we are hearing that they actually masters, relating to IT, information, digital skills and all that. So there are many ways on how one person can develop. So there are there's no really restriction as long as the postgraduate studies are willing and able to consider your Bachelor of Degree as the prerequisite, you are able to join already. But of course, if you're interested to know more about our postgraduate studies, do visit IMU website. We have many, we have more details about the courses that's available, that's more related from the related to pharmaceutical field. All right. Yeah. And I think this is a routine questions that usually participant will ask. What is the salaries of a new or PRP, basically newly graduated, graduate pharmacy that enter the job, that enter into a job, a PRP, how much they are paid. Yeah. Laura, you perhaps don't need to tell me very specific numbers. Perhaps you can share with me just a range, Yeah.
It really depends though. Government, hospital, community pharmacy, industry, research, they all have their own range. Yeah.
Yeah. Yeah, I mean, from what I know is that the range can go from basically 1,500 down to about 2,000 or even 3,000, plus and minus with all the different incentive. Yeah, because different places may offer different incentive, on top of that. So, and again, of course, this is a job, although it's called PRP, but it's a job offered. Whether it's offered by Ministry of Health, offered by a company and all that, it depends on whether the graduate themselves are willing or not to take up the job with the pay that is given, So, and again, because the job nature can be very different, whether you work in a hospital, whether you work in community pharmacy, where sometimes you may need to do OT overtime as well. So maybe they could have different, incentive given as well. So then because of the nature of the job could be very different, and some obviously needing you to do a bit traveling and all that. So that's why the salary range can actually be quite different, depending on where you're entering into it. Yeah. So, and then of course, graduates, when they take up the job, they have to consider this, if this is something important. Okay. Another questions that I see keep popping up is the requirement of what we call SPM Malay. Yeah? All right. I just want to clarify. I think based on some of the inquiry here, which is very accurate, is that if you are planning to work in Ministry of Health, basically means government. All right. They would consider your SPM Malay as compulsory, Bahasa Malaysia as a compulsory subject. Okay, but doesn't mean that it's not like you cannot work as a pharmacist if you don't have a SPM Bahasa Malaysia, because a lot of private sectors, like example, community pharmacy and all that, perhaps it's not so much a concern. Yeah, at the moment, it's only a prerequisite basically to enter a Ministry of Health job that you need a SPM Bahasa Malaysia. And again, the entry requirement wise, right? I think some of you are asking whether Bahasa Malaysia, basically SPM is entry requirement. Perhaps we will need more information about what pre-U courses that you're doing at the moment. So I would like to advise that you could write into IMU to find out a little bit more, because the entry requirement really need a little bit more detail from you so that we can give you a bit more accurate answer to whether you need the SPM Bahasa Malaysia or not to enroll into IMU. All right. All right. Let's go through some of the other questions. Is that what is the difference between pharmaceutical degree, pharmacy degree, and pharmaceutical chemistry? Yeah. Perhaps, Dr. Dinesh will give you the answer. Pharmacy degree and pharmaceutical chemistry, because we offer both degrees, right? Yeah.
This is a question which we get very often from parents. Well, pharmacy degree is a 4-year program, and it's a professional degree. So professional degree meaning that we can work as a pharmacist, whereas pharmaceutical chemistry is not a professional program, but it's actually a science program. So generally, if you see the job scope, like after BPharm, the students work as a pharmacist, right? And generally, like we saw the different setups where the students work, especially in hospital or in industry or in academia or research setups. Now, coming on to pharmaceutical chemistry, another major difference is that the students who are enrolled in pharmaceutical chemistry, they are more focused with chemistry. It could be the chemistry of drugs, for example, how they also do research. That means they take a certain molecule and then they find out how this can be improvised and how this can be more beneficial to patients actually. Okay, so if you see the setup where they actually work is predominantly in the industry, and when the students complete pharmaceutical chemistry, they are majorly recruited by pharmaceutical companies. So unlike pharmacy BPharm, and students, when they complete, they get to enter into hospital, clinics, and then these community setups or retail pharmacies. So unlike that, after pharmaceutical chemistry, students are predominantly preferred in the industry setup where they work as a chemist, or say, they also call it development chemist. That means they work on this. So mainly they are occupied with chemistry. So if you look into the program, what we have in IMU about the pharmaceutical chemistry is more of chemistry based. So from semester 1 until the last semester, they predominantly study more of chemistry based. It can be natural chemistry or it can be synthetic chemistry. But students, we advise students who are entering this program, they need to be prepared to face a lot of chemistry. Yeah, it's more of chemistry.
Yeah. They obviously need to like a little bit more chemistry and laboratory work, obviously.
Yes. Yes.
Yeah, isn't it? Yeah. Are there any particular field in pharmacy that in Laura, in your opinion, that is higher in demand now, like community, hospital, or industry, in your opinion? Yeah.
I think it also depends on the community that you're in, whether because job opportunities can come at different times. So whether there's like new hospital building at the areas, or things like, as we can see right now, community pharmacies are also actively expanding. So yes, but still competition will still be there in wherever field there is.
Yeah. So I mean, I fully agree with you. I think there is demand in both all areas, but it's again depending where you are. Obviously, the state that you are, the places that you are, and of course we do feel that actually there is a little bit growth on the private sector a bit more. But even Ministry of Health are actually in demand of pharmacists, in the sense, isn't it? Yeah, there is always a complaint about not enough pharmacists, not enough doctors, and things like that. Yeah, so there is always a demand there in that sense. Yeah, so pharmacy field definitely is a field that you probably wouldn't worry too much at this point of time, I would feel, of not having a job in that sense. But again, you have to understand that many people who have or graduated with pharmacy degree may not even end up in exactly a pharmacist job per se. They could actually work in a pharmaceutical company and work into certain other things, or even I have graduates who even work into business, entrepreneurial and all that. So, that's the reason why, even though we are producing or we are having a lot of graduates, basically, not everyone is entering into so-called the pharmacist job in that sense. Many of them would be doing other things. Okay, perhaps we have about 5 more minutes. And the last questions that I like to perhaps discuss a little bit is that maybe Laura, can you share with us a little bit, what makes you decide to do pharmacy course to start with?
So back then I was a science student, but I didn't really like physics. So things like engineering was out of my list. So with biology, chemistry, I considered something to do with health, in the healthcare field. And then considering things like my own interest and my own financial capability. So in the end, I decided to choose to go with pharmacy. At first, I'm just okay with it, but as time goes by, I enjoy it more and more now. So no regrets now for me.
Yeah. I mean, during your course of studies, I mean, now you are working in hospitals. Any plan for you to move into, master, postgraduate, or anything? Yeah,
I'm considering on it as well. So actively searching as well. It's good to keep learning and keep developing.
Yeah, so, that's good to hear. Yeah. Dinesh, do you have any advice for students who are seeking or sort of making decision whether they should take up a pharmacy course, whether the pharmacy course is the right course for them? Any advice that they should consider, or any factors that they should consider?
I would say that actually pharmacy program is a very well respected program, and even the demand for pharmacists is really high now, unlike before. So because if you look into the government websites, you see that we still lack a lot of pharmacists in terms of number. That means the ratio with pharmacists to population, we still are lacking, in terms of the number of pharmacists. So the demand is really high, especially at this point of time, especially after the liberalization, what we say. The demand is very high. So in terms of job, I mean, we don't really need to worry about job, because there is always a job ready when when a student graduate from a pharmacy program. So it's a very highly sought after program, especially pharmacy program. So only thing is that the students who join the program need to be very mindful of what is a cup of tea, meaning that are they really interested? If they're really interested to become a pharmacist, then you have to go for it. And if that's your passion, then you have to go for it. So that's the only advice I would give to the students.
Yeah. I mean, I sort of agree as well with Dr. Dinesh. I think you have, for those of you who are considering to go into pharmacy, I think there is usually a lot of concerns whether pharmacy course is the right one. Should I do pharmacy? I think it's really depending on what is your passion. And if you are not clear whether pharmacy is the right course or not, I'm sure you have pharmacy nearby, into your areas and all that. So my advice is that perhaps drop by one of the community pharmacy, have a word with the community pharmacy, or just observe what they're doing. Is that something you could vision yourself seeing? But having said so, you see, different pharmacists, there is a great difference between those who work in community pharmacy or those who work in hospitals, but at least, talking to some pharmacists will give you a little bit of background, what can you expect if you are a pharmacist in future, and can you visualize yourself doing that, Yeah. So, and if you think that that's the thing, that's your passion and it's something that you can accept in that sense, then I would believe that if you manage to get yourself into a degree course, you will be able to make effort to study. Yeah, because I think students who are interested in a course will find the course easier to go through, than someone who does not like the course at all. Yeah, so I feel that the motivation sometimes in studying comes from your passion to become the pharmacist in future. Yeah, so and that's what we are hoping to see. Yeah, so I think we have 1 more minute left. I just want to thank all of you again for being here today. And of course, thanks to Laura, thanks to Dinesh, and thanks to every one of you. There are, I think we have managed to actually cover most of the questions. There are multiple questions relevant to entry requirement, and certainly I think it's important questions for you to ask. So unfortunately, we will not be able to elaborate and give you in detail because the entry requirement obviously is very detailed. It depends on which PU course are you doing and all that. So I would advise that you can write into IMU for further inquiry based on the entry requirement and based on the pre-university courses that you're doing at the moment, so that we can offer you a more accurate data. So you can visit IMU website, then they will have more details in and about entry requirement there as well. Yeah. So thank you everyone again. Have a good evening, and thanks a lot again for participants today for spending your 1 hour with us. Hopefully you find this webinar helpful and useful for you. And of course, thanks Laura and Dinesh again. I think we shall end the webinar session today. Thank you very much, everyone.
Thank you, everyone.
Thank you.
Thank you.
Thank you.
Thank you.